So here we are, dude, a year later. Essentially, we're at the end of the year. It's December now, and we've got insurance. I got insurance this year. You guys know, if you've been rocking with me, you knew in January I got insurance for the first time. We've spent so much money on the insurance, and we've used it. We've used it a lot, but guess what? The insurance was a scam, and I'll tell you why. In January, if you guys remember, and if you don't, because most of you don't listen to every episode, let alone back then in episode 20, 30-ish, we've come so far. I'll give you a reminder. I got health insurance, and it's deemed to be not great. Every service I use my health insurance for that says they accept my insurance, aka my dentist, my doctor, my psychiatrist, my dermatologist, my chiropractor, they say they accept it, and then I go to my appointment, and then they're like, "You're good to go, Mr. McCurdy," and then I get a bill in the mail that I have to pay out of pocket because they sent it to the insurance, and insurance said, "Yeah, we kind of cover it. We told them we covered it, but like we kind of only cover it. So like just send him the rest in the bill. Send him the rest and he'll pay it whenever he gets the money." You know what I mean? So now I have like medical debt. I owe like the doctor. I owe like 3 different doctors' offices money now because insurance didn't pay for. I thought that's what insurance was for, but apparently not. So fast forward a few weeks, I get my insurance card, right? And so I start calling people. I want to talk to someone about anxiety and ADHD. You know what I mean? COVID kind of fucked us all up. And we know because Meg's just got done her ADHD journey. She got diagnosed. She's getting her meds now. Like, it's a whole thing. And so we're pretty sure with everything we learned from Meg's journey that, you know, I probably also should have been diagnosed with ADHD as a child as well. And so, but as an adult, it takes a lot more to get diagnosed. And so I made that appointment. I need to go see a psychiatrist to talk to someone about that, or just, you know, learn. Maybe I don't have it. Maybe I do. Maybe I don't. A couple appointments, we'll figure it out. You know what I mean? It's the responsible thing to do. So in January, as soon as I got my insurance cards, I went online to my insurance portal that my insurance company provided for me. And they said, click here to find a provider. They said, click here to find a doctor within your insurance network. And I clicked there and they said, what kind of doctor are you looking for? I said, psychiatrist. And so I called all of them on the list, and the list was about 20. And 19 out of the 20, even though on this list from the health insurance said that they were accepting new patients and they accepted my insurance. And when I called them, they said, sorry, Mrs. McCurdy, the voice thing, the helium, the lead paint, you know what I mean? They said, sorry, Mrs. McCurdy, but we're not accepting new patients and we do not accept your insurance. And so after calling the 19 on the list, I get those answers. And then the 20th one on the list says, oh, yes, Mr. McCurdy, Mrs. McCurdy, the lead paint, the helium, the balloons, you get it. Mrs. McCurdy, we do, they don't know me yet. It's fine. Mrs. McCurdy, whoever McCurdy, we will give you, we will accept you as a new patient and we accept your insurance. Holy shit. Look at me. Let's go. So I'm like, great. When do we start? A few weeks, a few months? How long do I have to wait? When's your next first available appointment? Mind you, this is like January 12th or something. February, March, April. When are we going? Let's do it. Let's get rock and rolling. I finally found one. They said, unfortunately, we're only scheduling out. Our first available appointment looks like December 6th. And I said, book it, I guess. You know what I mean? Like, thank God I don't have an actual problem. I'm wearing fucking $8,000 sunglasses right now. Thank God I don't have a problem. Okay? Thank God it's not a serious thing. And I'm not like on the edge of a building right now. And I have to wait 11 months just to talk to someone about potentially doing this thing and figuring out my mental health. So nonetheless, I said, let's book the appointment. And if I can find something sooner somewhere else or what have you, I'll still have that one and maybe I'll cancel it if I have to. You know what I mean? So I did it. I booked it December 6th. Called other places, called them, called this place, that place, this place. Oh, sorry. Now we're booking out till January 2023. We can't help you. So I have my December 6th appointment. Oh, look, it's now December 9th. How about that? I still have no appointment because on December 1st, I did the responsible thing. I called the psychiatrist. I said, hey, my name's Levi McCurdy. I have an appointment there on the 6th. I'm just confirming the address, where I need to go, what I need to do, who I'm talking to, blah, 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 like getting all the information. Meg said, get all the information so you know what's going on in 5 days. I said, you know what? That's smart. Let's do that. They're like, yep, Mr. McCurdy, we have all your stuff right here. She probably called me Mrs., but it's fine. And so she said, we got all your stuff right here, blah, 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 blah. And so I said, okay, great. That's great. And then fast forward 48 hours, it's now December 3rd. And they call back and they say, hey, Levi, it's Wendy from the psychiatrist's office. You have an appointment here on this date at this time. Here's the address, blah, blah, blah. And I said, yep, I just called to confirm it just a day or two ago. We're all good to go. I know where I'm going. I'm coming in. She says, unfortunately, we checked with your insurance and you don't have anything in relation to mental health, ADHD, anxiety, anything like that is not covered under your plan. And so I'm not sure what you want to do. We could charge you out of pocket, but here's the deal. Whatever we charge you, the insurance company, we still unfortunately have to process it through them. And at that point, they told me on the phone that they can charge you then whatever they want. So our charge would be $450, but they might charge you more. They might charge you less for going out of network. There might be a fee involved. So what do you want to do? And so I said, hey, lady, when I called in January, did no one think to maybe say, yeah, we accept your insurance. Let's double check that. Or like when I said, hey, do you accept my insurance? And you say, yeah, we got you. What's that supposed to mean? So now I've waited 11 months for this appointment. And come to find out, I call the insurance company. Well, they can't help me because it's like State Farm. You only call the 1-800 number when you're like dying or need the police or in an accident. And so now I have to call the lady who sold it to me. And guess what? That's not U.S. Health Group, Freedom Financial, health insurance people. It's Reasonable Rates by Rachel. And so I got to contact Rachel, and I text Rachel, and I said, Rachel, I need you to call me as soon as possible because we've texted before because it's 2022. And we've texted. I said, Rachel, I need you to call me as soon as possible. I'm dissatisfied with my health insurance. So she never called me. And so I took it upon myself 20 minutes later to call her. She answered. She said, what's going on? I said, where's my freaking insurance? I said, I'm paying out the ass for everything like dental and health and visits and all this other shit. Now come to find out after waiting 11 months, I don't have insurance to cover my freaking psych appointment. And she goes, oh, well, have you tried our telehealth? She keeps trying to sling the telehealth at me. She says, have you tried the telehealth? We have a great telehealth network. Have you ever heard of Better Care? Have you ever heard of I know Better Care. I know what it is. I don't want to talk to anyone on a Zoom call. I don't need to talk to a therapist on a Zoom call. I need to talk to a psychiatrist in an office about my ADHD. You guys think I have ADHD? You know what I mean? Like, it's clear. So let's like get the conversation started. At least want to learn some things, whether I'm diagnosed or get medicated. I don't care. I just want to know. I want to talk to this lady at this appointment that I've had scheduled since December 6th to work on my mental health. How do you think my mental health is now, health insurance? It's crazy to me to think that mental health isn't covered under my health insurance. And so I called him and Rachel said, well, what times do you have available on Monday? She said, we can get you on the phone on Monday. What times do you have available? We'll get you on the phone. We'll call Corpo together. We'll get your plan canceled effective January 1. And then we'll go over all the other plans. Within our network, and we'll get you set up with something effective January 1. And I said, wait a minute. I said, do I need you on the phone to cancel my plan, or can I call them myself? And she says, oh, well, yeah, you can call them whenever and cancel. But you would need me there. I'll explain the new plans and all the benefits and everything. So we'll do all that on Monday. And I said, Rachel, I'm going to call them in the next 5 minutes and cancel this shit effective January 1. And I said, you'll probably never hear from me again. I said, I don't need, and like insurance, dude, it's like, there's like levels. You can't just go to like highmarkblueshield.com and get health insurance. It's got to be Reasonable Rates by Rachel that sells the U.S. Health Group insurance, that sells the Freedom Financial Life Guide insurance, that sells Cigna. So at the end of the day, after 16 layers of bullshit, it covers nothing. I've been paying hundreds of dollars every month for absolutely nothing. I like almost want a refund. You know what I mean? So now, thank goodness, I called the psychiatrist's office and they have an appointment for me January 4th. So not another 11 months out. So thank God for that. They have an appointment for me January 4th. So hopefully between now and then I can figure some shit out. But like, I'm probably still going to have to pay $800 for health insurance. It's all fun and games. It's all fun and dandy when you've got a boss daddy. When you've got boss daddy paying for all or just half of your insurance, bro, half that insurance, gangster. Because those insurance policies you get with your fucking corporation and your company, those cost $800 a pop. But you only need to pay that $300 or $400. If anything, sometimes they cover the whole damn thing. That's gangster because they get it at a premium rate because they got thousands, if not hundreds of thousands, tens of thousands of employees to cover. So they get those rates. But when daddy's in charge and I'm the only one, there's no group rate. There's nothing else to be done. It's just me and there's no one else here. And like, the plans don't cover anything. They don't tell you anything. It doesn't make any sense. And so now I have to scramble, and in the next 20 days or 10 days, I think, open enrollment, and I can't even get insurance. If I wait, I don't think I can get insurance in February or something. Like, there's open enrollment. It's whatever. I don't understand it. It's a whole fucking scam.